Adipex-P is a medication containing phentermine hydrochloride. It is classified as a sympathomimetic amine and is used as a short-term adjunct to a reduced-calorie diet and increased physical activity for the treatment of obesity. Active substance phentermine hydrochloride. Indications. Adipex-P is indicated for the short-term management of obesity as part of a comprehensive weight reduction plan that includes dietary, behavioral, and exercise interventions. How to use. The typical recommended dosage is 1 Adipex-P 37.5 mg tablet per day. This should be taken in the morning, either before breakfast or 1 to 2 hours after breakfast. The dosage may vary based on individual response and the guidance of your healthcare provider. Swallow the tablet whole with a glass of water. Do not crush to or break the tablet, as this may interfere with the extended release mechanism. To avoid insomnia, it is advisable not to take Adipex-P in the evening, as it may cause increased alertness. Warnings. Adipex-P is typically prescribed for short-term use, a few weeks, due to its potential for tolerance development. You are taking Adipex-P in the evening to prevent insomnia. Inform your healthcare provider about all medications you are taking, including over-the-counter drugs and herbal supplements. Side effects. Common side effects of Adipex-P may include increased heart rate, elevated blood pressure, insomnia, dry mouth, constipation. Serious side effects may include chest pain, shortness of breath, severe headache, blurred vision, and allergic reactions. If you experience any severe side effects, seek immediate medical attention. Adipex-P is a prescription medication, and its use should be closely monitored by a healthcare provider. It is intended for short-term use as part of a comprehensive weight reduction plan. Follow the specific instructions provided by a healthcare provider and inform them of any existing medical conditions or medications you are taking. Always consult with your healthcare provider before starting or discontinuing any medication.